Hey guys, welcome back to another video. My name is Alexis if you're new here, and if you're returning, welcome back. I missed you. This time I decided to do this video in the form of a Q&A. I've had a lot of you asking me a lot of questions in the comment section, and I just felt like it made more sense to address all of your questions in a video because I'm sure there's more people out there who have the same questions as you guys. So yeah, without further ado, let's get straight into the video. So the first question I wanted to start with is, how can I gain experience if no one will give me an opportunity? So the good thing about working in the healthcare field and choosing this career in particular is that there are so many job opportunities and companies that are willing to train you and even pay for your exam as an incentive to get you to get certified within a certain amount of time. I'll admit though, it is hard getting your foot in the door if you have no experience, so I'll throw out a few things that you can add to your resume that will give you better chances. One way to help your chances is to take a quick BLS or CPR class. They are usually like a few hours long and you get your certification the same day. They cost no more than $55 to like $100, and most employers require this anyway, even as a certified medical assistant, and you're required to keep that certification current throughout your employment there. The more medical experience you can add to your resume, the better. The same goes for education. If you've taken any science classes or anatomy or even like medical terminology, definitely add that to your resume. And if you're currently enrolled in a medical assistant program, that's even better because you can just look at the syllabus and add all the courses that you've taken and all the courses that you're going to take and just add that to your resume. Another way to get your foot in the door is to try just applying for front desk receptionist jobs at medical facilities like primary care offices or OBGYN or whatever, just any type of medical facility or clinic that is looking for a front desk receptionist, because they're more willing to train you in that area. And then once you get your foot in the door there, you can get your foot in the door in the clinical area of things. And the best place to look for that would be small private practices because they're more willing to hire you and train you when you're brand new into the field. All right, so the next question is it hard? Is there math involved? Was there math on the certification exam? And can you live off of the pay? So being a medical assistant is not hard, and neither is the program. The only type of math we use is when we're calculating dosages for an injection or any type of like medication we're giving. It would be helpful to know how to convert certain measurements like centimeters to inches and etc. Other than that, any math you'll be doing will be very minimal and very basic. And also there's always Google. Like if you ever have a question about anything, you can always ask Google. As far as the exam, I can't really tell you if there's going to be a lot of math on the exam because everyone gets a different version of the exam. Like the medical assistant exam that I took is not the same medical assistant exam that my classmates took. There's different versions of it, I guess, to help with cheating, and also because when they give out these exams, they're kind of like using these exams as surveys to see like strong points and questions that would be beneficial and questions that they should throw out and stuff like that. So that's another reason why they give out different versions of the exam. I know that my exam had a lot of questions about pharmacology, safety, clinical workflow, ethical issues, and like insurance questions. They were pretty straightforward, and I actually thought I did better than I did. Like when I took the exam, when I finished it, I was like, oh, that wasn't so bad, that was pretty easy. But when I got my results back, I passed the first time, thankfully, but it wasn't as high as I thought I should have done. So I mean, the questions were pretty straightforward. It wasn't like really tricky questions in my opinion, but that was just my version of the exam. I actually still have my notes from the class that I was in, so if you're interested in a video on that, I can go through my notes and give you some study pointers. Just let me know in the comments and I can make a separate video on that. And for the last part of this question, when I first started working as a medical assistant, I was making $15 an hour. I had my own car note, I had car insurance, my own rent to pay, like all my all my bills. Like I was paying by myself. And as a single adult, no children, no dependents, nothing like that. So I would say that it, you know, it took care of me for a while. And I was just starting out. I definitely made more towards the end of my career as a medical assistant. I'm still certified, but I'm working as a pharmacy technician right now. But yeah, it was enough to sustain me as a single adult with no dependents. There's definitely more room to grow and more opportunity for you to make more money. The next question I got was, any tips for those in school? My biggest tip for those in school, I feel like this is gonna sound like cliche, but my biggest tip for those in school would to be have fun and be excited to learn. I feel like if you're not excited to study this field, then you shouldn't be going for anything in the medical field, period. To me, the medical field, at least in the beginning, it was so intriguing. Like I was so interested in learning about the human body, anatomy, I don't know, just like everything about health. I was just really eager to learn about it because I wanted to be able to help those closest to me and able to help my patients when I got into the field. I don't know, that's what helped me to stay excited in my classes. And also like as you progress in the class, as you like advance in the class, like not only are you like learning this stuff to study and pass the exam, but as you're learning it, it's just like, wow, like I never knew this. Wow, this is very interesting. Wow, this reminds me of someone that I know and I can go help them in that area. I don't know, it's stuff that it makes you think, I don't know, and it makes you like rethink a lot of your own life decisions. And I knew one day that I would be applying the knowledge that I know in the real world. So I wanted to be as knowledgeable as possible so that I can help people. My biggest obstacle at the time was time. I was already working full-time as a front desk receptionist at a primary care office. Then I would go to class like 3 days out the week for another 2 hours, Mondays, Wednesdays, and Fridays. And yeah, I was exhausted. If you're one of those students who don't have to work and go to school, if I can do it, you can definitely do it. Now I'm gonna get into some more tips later about like studying and just all that stuff. I'm gonna get into that later. But as far as like my biggest tip in school, I would just say like try to remember why you started, and then the end goal, which would be getting your certification and working as a medical assistant. I had to push myself extra hard. I was probably like one of the few students who were in the course that were also working full-time. There were some people who, you know, had children and had other stuff going on as well. But, you know, if you're just a student and you're not like doing really anything else on the side, then this should be a breeze. I would also recommend flashcards. That might have saved my life, honestly. That helped me the most when it came to memorizing like medical terminology, because it's going to be a lot of that you're going to have to memorize. And when it came to like clinical exams, like hands-on things like taking a blood pressure, I would just go home and practice on my friends and family. I recommend before getting into the program, if you're already in the program, it's fine. But I would recommend before getting into the program, buying a stethoscope, and maybe buying like a cuff that you can put on someone. I bought one. You don't have to buy one, but I recommend buying one so you can go practice at home on friends and family, because the only time you'll get to practice in the class when it comes to taking a blood pressure is on, you know, your classmates, and that would be during class hours, of course. So you would have no like chance to practice outside of that. The next question that I got is, what do the daily tasks look like as a medical assistant? This question is a little tricky for me to answer because it's a lot of stuff that is like you won't really understand it until you like start doing it yourself, until you get there. But I'm gonna try my best to explain it anyway. The first thing you want to do when you come in the office is make sure that the exam rooms are cleaned and stocked up. It should have been done the night before. Someone should have did it the night before, but you know, just in case. The next thing would be like checking the chart and prepping the chart. That's also something you can do the night before if you have time. It's not like really required, but me, I preferred to prep the chart the night before if I had time, because you know, it made my day that much easier the next day. And then as you know, as the day goes, you just grab the patient, get their weight on the scale, get their vitals in the room, go over any type of like changes in their medical history. You want to ask them about their medications, make sure nothing has changed. Go through their whole medication list. Doctors do not like if you ask them simply, did anything change with the medications? Are all your medications still the same? Medical history, medication list, allergies, surgeries, like any new hospitalization, stuff like that. You want to be thorough because the doctor is going to check over you. And yeah, it's not a good look. So as the day goes on, you might have things thrown at you. So doctor might come out of a room and ask you to give like a vaccine or A1C or EKG or do like an ear irrigation. You never know. So, you know, those are things that might, you know, get thrown in the mix while you're rooming patients. But other than that, it's pretty like, you know, it's pretty repetitive. And then as far as the end of the day task, because when you finish with your patients, that's usually the time when you get to sit down at your desk and do all the computer stuff and all the documenting and all the stuff like that. Like, you don't really have a lot of time throughout the day, if it's a busy day, to be like sitting there and documenting everything and get into all the tasks that you have to do on the computer. Like when you give a vaccine, for an example, a patient has to sign a consent form first. After they sign that consent form, you have to scan it into the computer, chart it, like save it onto their chart, and then you want to take that paper and file it in a book somewhere. But it has to be documented. At the end of the day, if I did like 50 vaccines, then I'll like take all those papers and then I'll scan it in all at once. If I have time, if it's a slow day, I'll just scan it in right then and there after I give the vaccine and after they sign the consent form and everything like that. The same thing goes for responding to messages. You'll have like your own little box, depending on the doctor you work for. Like if you work for one doctor or two doctors, all the messages pertaining to that doctor and the patients that fall under that doctor, all the messages will come to you. And then you'll decide whether to push it to the doctor if it's something that you know that the doctor needs to respond to, or you'll go talk to the doctor and ask them, you know, how should I take care of this, and then they'll tell you what to say. And then there's some messages that are coming directly from the doctor. They're asking you to send in a refill, or they're asking you to call a pharmacy about whatever, or they're asking you to send in an order for a freaking mammogram or colonoscopy or something like that. Or there's a question coming from the patient portal, and then you got to call the patient back and follow up on the question, stuff like that. So there's a bunch of messages sometimes that you have to get through towards the end of the day as well. And then you'll just like clean and stock the rooms at the end of the day, prep the chart for the next day if you have time. It sounds like a lot, but you'll get like the hang of it. You'll have like a flow that you'll get used to once it's been a repetitive thing. The next question that I got is, are there any specific fields you recommend going into as a medical assistant? So as a medical assistant, just getting out of school, I would recommend just going into primary care first. I mentioned this in another video already, but if you're fresh out of school, the last thing you want to do is go into a specialty, because you'll basically be at square one. You'll be learning brand new stuff. In school, they might touch on some stuff like OBGYN, pediatrics, stuff like that, but it's not as thorough. Like when you actually work in OBGYN or actually work in pediatric or work in ENT, there'll be a whole bunch of other stuff that you'll be learning that you didn't learn in class. The main stuff that you're learning in class is the main stuff that you need to know as a medical assistant. And then if you choose to go into a specialty, then you can specialize in whatever specialty that you decide to go into. The main purpose of taking a medical assistant course is to learn the basics. Primary care is basically where you will be applying all the basics. I feel like it makes more sense to go into primary care fresh out of school, is because you'll be able to get the foundation of what a medical assistant does, and strengthen your skills, and you'll be able to learn at a more steady pace. But if you go into a specialty and you're fresh out of school, you might still be trying to learn the basic stuff as a medical assistant on top of all the stuff that the specialty requires. So to me, it doesn't make any sense. To me, when I first got out of school, I went into primary care just because when I was working at a front desk, I was working at a primary care office, and I just moved to the back. That was a great idea, because there was some stuff that I still had to like get the hang of. I wasn't like an expert when I got out of school. There's still some stuff that I had to get the hang of. I had to do a few times to make sure that I knew it without requiring any help. And then as I became like a really good medical assistant, because I was doing really good, is when they started to float me around, and when they started to send me to specialties. And I mean, if you're at one of those companies that have different specialties within the organization, you won't be required to know everything that the specialty requires you to know, because if you're floating, then you're just there to help out. But if you decide to actually like go into a specialty and work there permanently, then you'll get the opportunity to learn like all the stuff that the specialty requires, and you'll see what I mean when I say that it's a lot more than just the basic stuff that a medical assistant should know. So yeah, I would recommend going to primary care, getting the hang of that, getting the basics, getting the foundation, and then if you're interested in any other type of specialty, then going into that specialty. I mean, I'm sure there's people who have went straight into specialties right out of the program. I just wouldn't recommend it because my experience working in specialties is very, 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 very high, fast-paced. Next question I got was, after getting certified, how long did it take you to get hired? Because I was already working at a primary care office as a front desk receptionist, once I got my certification, they were quick to like move me to the back and get me cross-trained. So I was basically working as at the front desk and working in the back as a medical assistant. I was doing both. And because they were able to use me as both, I was able to ask for a raise a lot quicker. Okay, I really do like this question right here. It says, how did you balance classes and training as a medical assistant? I balance classes and studying and working full-time by remaining organized. I had a planner, and I still have this planner. Like, this is the planner. I was actually about to throw it away the other day, but I'm glad I kept it because I can use it and show you guys exactly how I used it. But in my planner, I wrote out my work schedule. I wrote out my class schedule. I wrote out my exam schedules, like when we're supposed to be taking tests and stuff like that. And just anything that, let me see. Just everything. I literally wrote everything in here. I don't know if I want to show. Hold on. I might have to blur some now. I don't know. I had like highlighted everything to separate, like the pink was my classes, the orange was like bills, the green was paydays, the yellow was like my work schedule. I had color coordinated and everything. Like I had everything organized in this planner. I took it with me everywhere so that I could like refer to it if I ever needed to, or if I need to add anything to it, I would, add it to it. I brought it with me to work. I brought it with me to class. I brought it with me to the grocery store. Like I brought it with me everywhere. I also will be releasing a planner of my own pretty soon, probably like this month, honestly. And I'll add it to the description box, and I'll add it to like my bio on my channel. I'm actually super excited because I've been working on this for a while. And when I say a while, like I've been working on this for a very long time. So if you're interested in purchasing a planner from me, yeah, I'll be launching it soon, and maybe I'll like make a short or a video or something about it just as a reminder for you guys, or when I do launch it. But yeah, I'll be launching one of my own planners soon. It'll be like an undated planner so that whenever you receive the planner, you can just start in the month that you received it. So it's going to be a 12-month planner, and yeah, it's going to be perfect for students, perfect for those who are working and also a student. I'm trying to think of every person in this situation who would need a planner, so trying to just consider everything for this planner. But yeah, it'll be coming out soon, so stay on the lookout for that. When it came to feeling stressed or overwhelmed, I just took a break. I don't know about anyone else, but I struggle to relax. Like I struggle to like put work down and just like chill out for a little bit. I'm like one of those people who just like have to be doing something, have to be working towards something. And taking a break is essential. Taking a break is a part of working hard because you have to like give your body a chance to recover, give your mind a chance to recover. Yeah, I learned to, or I had to teach myself to rest, to take a break, which is crazy. It's sad that I had to teach myself to take a break because the only break I was taking was sleep. Not taking breaks can also lead to burnout. So that's another thing you want to keep in mind. So for those of you who may be the same as me, I recommend setting a timer when you're studying and setting a timer when you're taking a break. And this is something that I learned recently, and it's been a game changer because I'm still in school for something else. What I learned to do is I set like a timer for an hour to study. And then once that alarm goes off, I'll set another timer for 30 minutes to take a break. And then once that alarm goes off, I'll go back to studying for another hour. It's recommended to study 2 to 3 hours per credit hour that you're taking. So if you're taking like a 12 credit hour course, then you want to study 24 to 36 hours per week, or 5 to 6 hours per day. So if you're not working, then it should be easier for you to make time to do that. If you're working like I was, then it might not be as easy for you to squeeze in 5 to 6 hours out of your day. But even if you can do like 2 to 3 hours, 1 to 2 hours, that's better than nothing. And like I mentioned earlier, flashcards really made a difference for me, like because it forced you to use your memory, and not just your short-term memory, your long-term memory too. Eventually it starts to work on your long-term memory, but for short-term memory it really did help. And then, like I said, eventually for long-term memory, it actually really helped me to memorize stuff and keep it in my brain for a while, at least until I finished school. Oh, okay, so that was the last question actually. Yeah, that's all I have for you today in this video. If you have any further questions, definitely leave them in the description. If you have any further questions, definitely leave them in the comment section for me. I'm more than happy to answer your questions, and they also really give me ideas for my next video. Please keep it coming with any questions that you may have. I'm willing to answer any and all questions. Also, don't forget to be on the lookout for my planner that will be coming out soon. I'll be having like the link to my website in the description box soon and in my bio. And yeah, I hope this video was beneficial. I hope it helped you in some way, whether you're thinking about becoming a medical assistant or thinking about getting into the program or already in the program, or even like already working as a medical assistant. If you have any questions in any stage that you're in, let me know in the comment section, and I will see you guys in the next video. Bye.